Welcome to Let's Talk. I am Dr. Anita Raja, and like every week, today we are bringing an excellent topic to your attention. As you know, the world is full of migrants. You'd be quite surprised to know that according to WHO, 1 in 7 people out of the total population are actually migrants, which is 1 billion of the total population. However, 82.4 million out of the whole population are forcibly displaced, which is unfortunate. Now, out of these, 26.4 million are refugees, whereas 4.1 million are asylum seekers. Many of us have got the education, the resources to help these people who actually make part of the most vulnerable section of our society. However, we get busy with life, and not many of us are able to reach out to these people, help them. There are, however, a few still amongst us who have the will to come forward and work for these people, these refugees, these asylum seekers, relentlessly, unconditionally. And today we're going to celebrate one such woman, Dr. Hadia Aslam, who is here with us today. Welcome to our show, Dr. Hadia. It is such a pleasure to have you here. You're absolutely inspirational. And believe it or not, I've been following your journey for a long, long time. And then one day I just thought I have to ask you the question, can I interview you? And you kindly agreed.
Assalamu alaikum. Thank you, Anita, for your kind words. Yeah, I'm super excited to be here. And when you asked the question, I was aware of your work, so I had to say yes. Couldn't say no.
Dr. Hadia, you know, not many people have the will or the courage to do what you have actually achieved. I mean, when we look at your CV, you have worked relentlessly. You're a GP by trade, but you've done a lot of relief work, and you specialize in this type of healthcare, and you're a consultant when it comes to this. You're a leader. Tell us about your journey. How did you actually think about helping people who actually make the most vulnerable section of our society?
How did I think about it? I think for me, the exposure was quite early, actually. I come from a Batan community. I'm from a Pashto-speaking family. I understand you're quite familiar with this community, but a lot of people are not. And when I was growing up in Pakistan, I actually was exposed to these communities repeatedly. You know, Pakistan holds a very, very big number of Afghan refugees. If anything, it hosts one of the largest refugee populations in the world. And often we forget to mention this when we're discussing refugee communities. So when I was growing up in Pakistan, I was exposed to these communities. I started working with them when I was at medical school, in particular the Swati refugee population. And then when the incident of Ayan Kurdi was all over the European media, I traveled to France and I started my work in Calais, Dunkirk. That was in 2015, where I had finished my GP training by then. So I was able to leave and commit time fully, full time being amongst other people actually who were doing the same thing.
But you know, when it comes to family support, did you get the support that you needed at that time? I mean, it is a bit odd, isn't it, that you come up with this idea that you're just going to go to Dunkirk, you're just going to help people out, especially belonging to a South Asian Pathan family. Was this welcomed?
Pathan, Pashto-speaking family from a certain part of Pakistan where girls do not really receive an education beyond 16 years of age. It was difficult for my family, but I think by then my parents had gotten used to the idea of me being a bit of a rebel, if I'm being honest. And I think they knew that they probably wouldn't be able to convince me otherwise. My mum would often worry about my health, if anything. My dad couldn't understand what I was doing, and he thought it's probably just one of my other many passions. My sisters, my brother, they were supportive. My nieces and nephews, I should mention, they supported me, and I have actually a very big family coming from this community. So a lot of my cousins were constantly supporting me, and one in particular used to go around the local community fundraising. And as we all know, the Muslim communities are um, very forthcoming when it comes to giving charity. So she was able to generate a lot of funding, and that's where my very first clinic started in Dunkirk, which later on became a fully fledged charity called Health Point Foundation, which people should certainly check out. Um, yeah, I think now they've. I think it's history now for them, really. So no, I don't get any more grief from my parents.
Right. And at that time, when you were setting up your camps, of course, you're absolutely right when it comes to charity. Muslims are very charitable, and they're very generous when it comes to helping out other people. And we certainly should be proud of this trait of our people. But at that time, when you went out and you set up your camp, did you reach out to like-minded people? Where did
Yeah.
you find these people, or did you do this single-handedly?
No. You can't do this type of work single-handedly. And I had amazing friends, and they became part of the first organization, Health Point Foundation. We went to medical school, and together I had a colleague from dental school. You can never achieve the development, founding a charity and developing that charity. It can never be done alone. But even beyond the founding days, for it to continue, you need other people to carry on supporting you, whether they're donors, whether they're helping you remotely, whether they're coming and volunteering from your clinics. So in the grassroots sector, there is an enormous amount of teamwork that happens that people are not aware of. You hear about MSF, you hear about MDM, you hear about Oxfam, you don't hear about the grassroots sector. And it's with the sheer will, teamwork, voluntary time, funds of people like me and you, that this sector exists.
And you then ended up formulating two international medical charities as well. I don't think you really stopped there, did you?
No.
You set up your camp and then your journey just began. So tell us about it.
Yeah, so it started formally with the Syrian Afghan refugee crisis in Dunkirk and Calais in 2015. But then I moved to Lesbos, to the Greek island, where we were receiving refugees off the shore. And here we set up the very first 24-hour clinical unit. After Lesbos, after over a year of doing the work in the refugee camps, and when the Turkey-EU deal took place and refugees were being prevented from traveling through Europe, work became extremely difficult, but our work had become fairly well established by this point. I'd handed over the charity to my colleagues, and then I moved on to Lebanon, where I was consulting for another NGO. They'd asked me to come and take a look to see if in Lebanon, in the Bekaa Valley near the Syrian border, whether there was any scope to develop a healthcare system for this particular charity. So I worked there for a few months, and then from that charity, from that work, from that base, I teamed up with a really dear colleague and friend of mine, Dr Faraz Al-Ghadban, who, we both together founded the very first mobile healthcare unit in the Bekaa Valley, because a lot of refugees there are unable to come and attend clinics themselves. Geographically, these camps are settlements. They're located very far away from each other and far from healthcare services. So refugees needed some sort of a service that would go close to them, situate in the camp, and then be able to deliver some sort of a triage service at least. So we invested in that personally, and we were able to develop that over the last 3 years, and that's become now a fully fledged charity. That's called Endless Medical Advantage, if anybody wants to take a look. It now works with the Syrians and the Lebanese people who are struggling, as we know. Recently, they've had a storm, and they need assistance in all types of areas. I work also in the training sector for the NGOs internationally. So I deliver training on health education. Currently, we're working on a project where we're developing some training programs for doctors in Iraq, in Libya. Beyond that, I've done training in the UK as well for doctors, making them aware of the needs, the healthcare needs of refugees, of asylum seekers. Yeah, I like to work as a clinical advisor for NHS England at times, and sometimes I'm invited to things like these, which I enjoy a lot. Yeah, I think that's about it.
It keeps you very busy, doesn't it? It's amazing. I mean, the type of work that you're doing is actually, it's amazing because, as I've said in the beginning of the show, that, you know, many of us do have the resources, we've got the education, we've got the ability to actually go out and help people, but we lack the courage. It's the will is probably there as well, but we lack the courage, and sometimes that can be one of the biggest obstacles. Viewers, as you know, you can be part of our show. Our telephone number is on your screen, 01924231083. Our WhatsApp number is 07585835150. I've got two questions here, but I think we're about to go on to the break, so we will sort of save that question for later. However, if you want to be part of our show today, our topic today is refugee, asylum seeker, health awareness. As we know, 1 billion migrants in the world. We ourselves, our parents were migrants as well. However, the dilemma is that 82.4 million are forcibly displaced, out of which 26.4 are refugees and 4.1 are asylum seekers. And when we talk about people who are refugees, asylum seekers, unfortunately, they make the most vulnerable part of our society. They are subjected to xenophobia, racism, they have housing issues, they've got healthcare issues, language barriers, you name it. And they are faced with challenges which are absolutely endless. The beauty of the NHS, however, is that if you are a refugee in the UK, you do not need an ID, you don't need a permanent abode, you can actually get registered and take the help from healthcare professionals, which is quite beautiful when we look at it and compare to the rest of the world. Viewers, if you want to be part of our show, very easy. Our number is on your screens. Our WhatsApp number is on your screens as well. Stay with us. It is time for a break. Welcome back to Let's Talk. Before we went on to our break, we were speaking to lovely Dr. Hadia Aslam, who's here with us today to discuss refugee health. It is an area that I think we still need to talk about and understand a bit better, because there's so many of us out there who really want to be part of this, help out other people, asylum seekers, refugees. However, we don't know how to go about it. So we've got lovely Dr. Hadia here, who's got a vast experience under her belt. So she would have made the most beautiful guest for our show. Dr. Hadia, before we went onto the show, we were talking about all the projects that you have done so far. What are you doing these days?
These days, I'm working on a project too, actually, where we're trying to develop some training material for doctors based in Iraq as well as Libya. And people like me and you, Anita, we tend to get some very structured training after medical school. You know, we're very lucky. We live in a country where we are fully supported. And we are given opportunities. If we look for them, we're given them. We have a lot of research that's done, of course, behind these training programs that me and you follow and train under. But in post-conflict countries like Libya, like Iraq, doctors do not actually receive this training once they've graduated from medical school. And they need our support, because for how long are people like myself going to be able to go there and deliver clinics? You know, for how long are we going to be able to do that? It's just not a sustainable system, and that's why it makes a lot more sense to be able to help individuals on the ground from startups, from the moment they leave medical school, supporting them through training programs. And if we can't deliver structured training programs, being able to somehow create some sort of network with universities or training institutes abroad to be able to give these doctors the support that they need. With COVID, we're now able to do a lot of things remotely that we were not able to previously. So I don't see why that's not possible. So we're working on those solutions at the moment, and we're very excited about these. So if people do want to get involved, they can find us they can find myself on LinkedIn, on Facebook. A lot of doctors I know want to be able to help because they're not able to visit these countries. They want to be able to help remotely. And a lot of nursing staff actually who also need our support in these countries. We're trying to develop something similar for them.
In terms of challenges that doctors in these countries face, what areas have you identified where you are particularly interested in training them?
The areas, if you don't have a training program, Anita, you're going to struggle. You know, you're not having also the up-to-date guidelines. For example, one simple subject would be COVID. You and I, we received daily guidelines when it came to practice. We were receiving emails after emails, a few in a day, telling us what the latest guideline was, what the latest research was when it came to COVID treatment in the community. These doctors do not have access to any of that. They're working from experience. They're not working from guidelines. There may be some national guidelines, but often they're not being supported because they don't have access to these guidelines. That's one of the challenges. Yeah, it's extremely difficult actually. And, you know, a lot of the viewers may be able to relate to this because a lot of my family who live in Pakistan, I often see that doctors are not given or they don't have the access to these types of guidelines and this structured, structured training programs, which make a massive difference when it comes to patient care.
It definitely does. And I totally agree with you because I've got many colleagues, friends back in Pakistan as well. And I totally agree with the fact that the way we are trained is so different and we are very well equipped. We've got two questions, Dr. Hadia. The first question we've got is that I have a friend that came to the country as a refugee. They won't really tell me much about their healthcare struggles when they arrived. Is there any chance you guys could potentially give me a little information as to how bad it is so I can be a little more understanding?
What a terrific question. This is so important because part of my training is often orientating people in host countries, telling them the journey that these individuals have gone through when they've eventually arrived to the country, to the host country, what their mental state is, what their physical state is, what their emotional state is, what their spiritual state is. And in the last 10, 20 years, of course, the UK in particular has really suffered from unfortunate media news reports about refugees, to put it lightly. And you see the reaction of the public, you know, towards refugees and towards migrants and asylum seekers. It's not always positive. So for you to educate yourself, I think, is a fantastic place to start. Where can you learn about this? You can have a conversation, of course, with your friend, but maybe just start looking online, start looking on YouTube. There are individuals actually who've recorded their journey when they've got onto the dinghy boat, for example, from Turkey through to Greece. They've actually got their camera phone recording their journey to be able to make people like yourself aware. So, you know, do a YouTube search, do a Google search. There are many refugees on Facebook, actually, and I don't like to refer to them as refugees because they're people like you and I. You know, it tends to separate them from us. But people who have gone through these difficulties, for you to stand in solidarity with them, please educate yourselves. And you can find a lot of information firsthand that's available on Facebook, on Instagram, on Twitter. You'll be able to find a lot on there.
Lovely. There's another question. The question is, I often see the state of how refugees and asylum seekers are being made to live when they first arrive here. It's because something I really want to try and help out with. Would you by any chance have any information on the best ways to volunteer help?
I'm aware certain charities are taking lead now. So reach out to the main charities in the UK. Again, have a look online and see which charities are working with refugee communities and asylum seeking communities. In the South in particular, we have a lot of public solidarity with refugees and asylum seekers. In Wales in particular, I'm aware there's a very, very effective movement in Bristol. So I don't know which part of the country you're from, where this message is coming from. It will depend on what's happening in your locality. Facebook is a massive platform when it comes to assisting refugees or creating networks. Please do a search on that Facebook search bar to see what's available in your country, sorry, in your city. Info points, for example, you can look in the actual search bar, look for information about refugee communities in the UK, for example. Play around with words, see what comes up.
Right. So Hadia, you mentioned something before we went on to the questions about the attitude of the host to these refugees. I mean, unfortunately, when it comes to being an asylum seeker or refugee, there is a certain stigma attached to this label of being an asylum seeker or refugee. And it is assumed that they are probably very poor, they're uneducated, uncivilized, just because they are actually refugees and seeking asylum. And we totally forget the fact that they could actually, maybe they were a neurosurgeon back home, maybe they were a multi-millionaire businessman back home. So how can we change that attitude and accept them as human beings first, and refugees and asylum seekers after that?
Why do we have to accept them as another body in the first place? I think this is where we're creating this us versus them attitude. When I go and live in Dubai, why am I considered an expat? Whereas when my parents came to the UK, why were they considered immigrants? I've never really understood this concept because, you know, I feel like it's going to be difficult to change that narrative when we're receiving refugees, because often we feel like our resources are being taken. You know, we're having to share now resources. So maybe it comes to tribal mentality where we don't want to share things. I don't know, that it's multifactorial. How do we change it? I think exposure is important. You know, people who travel all the way, go through extreme difficulties and arrive into host countries, often have a lot of skill behind them in order to even reach to the country, reach to our country. They have gone through a lot of hardship and they've gotten past that hardship because they actually have banks and banks of skills themselves. So, yeah, people who are neurosurgeons in their home countries are now having to work as in takeouts. There's nothing wrong with that. There's nothing at all wrong with that. What's wrong with it is the perception that the public has of an individual that works in a takeaway. And again, we're coming to those key problems that we're dealing with right now as a population and as a community, how we look down on people who are not like us.
Yes, that's right. We're not privileged like us because we probably did not have to face the hardships that they have.
Right.
Now, Dr. Hadia, we are towards the end of our show, but I definitely want to take a message from you. Anything that you want to say to anyone who's watching us today, any message you want to give out?
Yes. I'm hoping lots of Muslims are watching this show, and I actually, through my journey, have, as an aid worker, have found, unfortunately, Muslim communities being fairly hesitant to go out and help in communities compared to communities that don't follow the religion of Islam. And I've always wondered why. And I just want to ask this question, really: why are we not seeing more of you out on the ground? And it's not criticism at all. It's a genuine question that I have. I'm trying to understand why we're not allowing our youngsters to go and help out in communities that are abroad or even local to you, you know, asylum seekers who may need help, refugee families who may need help. Why are we not educating our children, our communities, about the needs of these individuals? And why are we scared as Muslims to help our fellow Muslims? The majority of the refugee communities are Muslims, unfortunately. So yeah, I just want to leave you with a thought to ponder on, and I'd really like to know the answers, because I've been confused for a very long time about this.
It's a very beautiful question, Hadia, and I think it's going to leave our viewers thinking. Is definitely a point that we really have to ponder upon, because you are absolutely right. Why are we so hesitant? We are very generous when it comes to donations, but when it comes to actually coming forward, doing the field work, why are we missing? This is a very important question. Thank you so much, Dr. Hadia, for being part of our show. It was an absolute delight to have you with us here today. Thank you so much.
Pleasure is mine.
Like every week, we are coming towards the end of our show. Hopefully, we're going to catch you again next week with another amazing topic. If you want to be part of the show, very easy. You can find us here on Sky 752. Till then, take care. Allah Hafiz.